Okay, we're on 7 p.m. We are waiting for a few more people to join, but we will get started on time as I mentioned a few minutes ago. So yes, welcome everyone. Thank you for joining us this evening and making time. I appreciate this event was also rescheduled, so thank you for those that have rescheduled diaries and calendars to attend this evening as well. Hopefully, by the end of the session, um, you will have enjoyed and learnt a few things today, and also have some practical tips and ideas to take to your own businesses or your own services that you manage. So yeah, from my side. My name is Lewis. I'm the Chief Operational Officer here at LearnPack Systems. I will be the sort of host today, managing the questions that you have, the chat box that we have, and making sure that the event runs smoothly. And I'll hand over to my colleague Richard in a moment once I've just gone through some of the housekeeping rules. He will be the expert today, giving you some practical advice on today's subject, which is subject matter expert to a safe trainer. So, as I mentioned, I'm the events management person. You'll already seen I've put some messages in the chat as we're about to get started now. The chat box is open to everyone. We do need you to participate in this event to get the most out of it and to make sure it's as interactive as possible. We don't want death by PowerPoint. So please do use the chat box when prompted. Also, if you have any other questions, we have got a 15-minute Q&A section at the end. So from around 6:50 to 7:50 to 8 p.m., sorry, we will be doing a question and answer section, but we will be encouraging you to use the chat throughout in some of the activities that we've got planned this evening. So please do use that and save the Q&A for the end of the session. I'll also be sending a Google form that you need to fill in if you need your 1 hour CPD certificate, which I'm sure you will all take advantage of and make use of. It's obviously very important to be logging this CPD and have evidence. So I'll be sending that out as we start the Q&A. So you'll have the last 10-15 minutes to fill that in. You do not need a Gmail account to fill it in. It is a Google form, but you do not need a Gmail or Google related account to submit it. Everyone that submits it and has attended for the majority of the session will be eligible for a certificate that they'll receive tomorrow via email from our team. So please don't forget that and keep an eye on the chat for when I send the link to that particular form, and make sure you fill it in correctly, because that'll be what is displayed on your certificate. Um, There'll also be a follow-up email going out after this with some of the downloadable toolkits and other practical resources that we're going to provide for free after this event for all of you that attend. So keep an eye on your emails over the next couple of days as well for any follow-ups, and you'll also maybe hear from some of our team members as well. So without further ado, I will hand back over to my colleague, Dr. Richard June, to introduce himself for those of you who don't know him and get started with this evening's event.
Thanks, Lois. Welcome everyone to this session. It's part of a series of sessions that we've been running since last year. I think it's the sixth now that we have done regarding different aspects of the trainer model. So I'm one of the directors at LearnPack Systems, and I work with Lois. Background is in the clinical sciences and research. I also worked for quite a few years in the NHS as a nurse on the front line before I went into clinical research and technology research. We've been in this sector now for over a decade, so building systems, e-learning platforms, compliance systems, and helping organizations meet regulatory requirements for the Care Quality Commission, primarily in England, but across the world as well, helping to strengthen health systems through technology, but also redesign of curriculum for nursing schools, medical schools, and just for businesses as well in that sense. So today we're talking about how you move from a subject matter expert to a safe trainer. So a lot of us actually that are coming from healthcare, social care backgrounds, we will have expertise in many different areas. And many of us are even involved in mentoring people, assessing people, running induction training programs, all sorts of things. But it's quite different then to move from being a subject matter expert to become a competent trainer who actually can deliver training safely. So that's what we want to focus on. Luis has explained how things will work. I'm leading on the presentation and the discussions, but Luis is going to come in with a lot of activities as well to get everybody to engage. So we will discuss why it matters to think very carefully before you assign subject matter experts to become trainers and what you need to think about to consider there. Also, what do we mean by trainer competencies? And one element, some of you may have done the award in education and training, where you do what's called a micro teach. So we'll talk about micro teach and why it's important, even when you're not going through the award in education and training or AET framework. It's still quite an important way to assess your trainers. Then we'll also talk about refresher systems that work, because a lot of people do train the trainer courses and they never do any refreshers at all. But yet, actually, things change quite a lot. We'll talk about quality assurance as well. It's not just paperwork, filling in paperwork. It's something that actually should be built into the compliance framework, the governance framework for your organization. Then we'll leave a good 10 to 15 minutes at the end to do a question and answer, because last time we actually ended up staying a bit longer because there were so many questions and discussions coming in. So we'll finish a bit early today so that we've got time. It's an interactive webinar, as we said. It's not just lectures where we're lecturing at you. We're going to do a lot of polls, discussions, and case activities where we need to hear from you as well. On the right, I've got some of the things that Louis said you'll be able to take away. You'll get emails starting to trickle into your email addresses that you provided tomorrow morning. Everything that you need to build a trainer competence framework for your business, as well as the micro teach workflow, even if people are not doing the AET, as well as some of the refresher considerations you need to think about. So we have what we call a trainer toolkit starter pack that we keep improving every 3 months. When we run these webinars, we make improvements to those. So even if you have downloaded it before, you'll find that if you go to your account now, we'll add new materials as well. So let's start with a baseline. So I'll hand over to Louis to just get a bit of a baseline as to where we are as far as how we are currently assessing trainer competencies, whether formally or informally. Actually, I know it says formally there, but we'd like to hear how you're doing things right now. So over to you, Louis.
Thank you, Richard. Yeah, so I'm going to launch the webinar poll now. You should all see that on your screen. There's 4 different answers. You need to choose a specific one. So it'd be great if everyone could participate in this, and then we'll get an understanding as to where the group are with assessing trainer competencies in their organization or within their service. Okay, brilliant. Starting to see some answers trickle through. So thank you very much for being swift on that. Okay, excellent. I think majority have answered now. I'll just give the last couple of people another 30 seconds, and then we'll take a quick look at the results from our first poll. We tend to give people around 90 seconds for these polls just so they are relatively swift, and then we can get into the data and see where people are. Okay, we are now on 90 seconds. So most of you have participated. Thank you very much for that. In terms of the answers on the poll, we've got quite a mixed bag here. The main answer, which is around 30% of you, is no. You don't formally assess trainer competence, but we have 25% for yes and partly, and also 20% exploring it. So quite an interesting group actually of people at various stages of this journey, in terms of implementing train the trainer and assessing trainers in their organization.
Thanks, Luis. That's actually quite reflective as well of what we see, because on the other side, we're actually a training company. We provide statutory and mandatory training for organizations. And one of the things we always want to do at the beginning is to do an assessment of what the organization is currently doing. Do they have needs analysis? Do they have a training matrix? If they've got internal trainers, what qualifications do they have? When did they last do their refreshers? Were they formally assessed? And we have found over the years that the numbers are getting better because also when the regulators come in and the commissioners, they're starting to ask questions of trainers as well to see whether you're doing things formally. So thanks for that, Louis. We'll keep that in mind as we go. Okay, so we'll move on now to the next stage. We want to talk about why this matters. Because trainers being current or not current, are they up to date or not? That really matters because you want consistent delivery, right? Not just people standing in front of a group and delivering slides. So it's not simply a matter of having trainers. It's actually saying, are they competent and current? And if you have more than one trainer in the organization, if you're not assessing competencies and delivery as well, evaluating delivery, you're going to have variation as well in how training is done by one trainer and another. Then assessment and feedback are quite important as well. We know that a lot of work that we do in health and social care is based on work-based assessment. So in work training, even the apprenticeship model actually it's been around in healthcare and social care for a very long time. And if you're not assessing people properly, you're not giving them proper feedback, then yes, you're delivering a lot of training, but you're not actually checking as to whether that training is working or not. And one of the issues that we find as well, we found over and over again, is the lack of a refresher system. Part of this is the fact that many people would have done the award in education and training many years ago. Then it's almost used as a license to train any subject, even in areas where people don't have the expertise to train in that subject. They use that certificate as almost covering everything, which it doesn't. So you find that when people have old habits, and every trainer will have their own habits, they tend to get outdated. And then that actually filters into practice as well, and it filters into the outcomes for the service users, but also the business as well. There can be quite a lot of damage there. The other issues around scope and permissions. Our previous webinar, actually in March, we did cover this to say you need to have a trainer register, and then you need to make it very clear what qualifications the people have and experience, and also what they are qualified to train, what you're signing them off to be able to train. It's just like if you have a group of nurses or care workers, you're not going to let all of them do everything. There's some maybe that have more skills than others, maybe some are more experienced, and maybe some are still in training. So you don't want people to train beyond what has been agreed within the organization. And the last element is evidence, because more and more commissioners and regulators are asking for evidence. And as a business or organization, you start to struggle to prove that these people have real competencies and also the oversight systems that you have in your organization. So confidence is not competent. I know a lot of people that are very confident, they'll stand in front of people and say things very confidently, but doesn't mean that they're competent. And if you have a past train the trainer certificate, that could be outdated, or if you have an award in education and training, but you don't have anything else to back that up, you're going to struggle as an organization to prove that you have competencies. So, Louis, let's talk about the risks. Perhaps when you look at your own organization, think about the biggest risks based on the previous slide, where we were looking at maybe inconsistent delivery, weak assessment and feedback, lack of refresher systems. Maybe you don't have a trainer register which gives people scope and permissions. Maybe you can't evidence the trainer system that you have. So what do you consider to be the biggest weakness or weaknesses that you currently see with your trainers?
Yeah, so I've put a message in the chat. We want you to use the chat for this particular activity, so we keep it quick. We appreciate there may be some very different or a variety of different answers here. So I will keep an eye on the chat as answers come in, and I can see some answers are coming in already. So thank you very much for that. So lack of funds is probably the first one we've seen. Weak assessment and feedback. Um, Thank you for that. Time constraints. Lack of structured train the trainer courses, Training varies between different trainers. Time is coming up again. That seems to be a popular theme based on what I'm seeing in the chat. Lack of training, lack of consistency, very individual approach. Yeah, these are all very common themes.
Yeah.
Update of information from trainer. I think that's a very interesting point there. Thank you for that one. Keeping information accurate it can be very challenging
Yeah.
if there's not a good system in place. So thank you for that one. That's quite a unique one. I'll just allow another 20 seconds or so for a bit more. Quality validated training. Training varies from different trainers, so different styles. Thank you for that. See, some of these weaknesses could also be turned into strengths as well with a little bit of work, but law changes not shown in training. So yeah, again, we're talking about the content there, the accuracy of the content being delivered. Very important point. Lack of support from management. Okay, yeah, I think that's an interesting theme that we also see our side as well. Trainers can often be isolated in organizations as well, where they are left to do maybe too much with poor systems around them. So I think support from management is an interesting point there. Language barriers, yeah, we have to appreciate we have um, various nationalities working in these services up and down the country. It's definitely a challenge. Okay, I think we've got a nice mix there, Richard. I don't know if you've got any specific ones you want to home in on, but yeah, we've got an
Look,
interesting mix there.
yeah, I mean, then again, there are no real surprises there. Train the Trainer is yet to mature as a model. It's something that has been around for a very long time, but we call it a cottage industry, really, in a way. Unlike other areas where there are clear frameworks to use, Train the Trainer is still something that is trying to find its space. So funds is always a big problem because even when we talk to commissioners, and organizations like Skills for Care, local authorities, what they are trying to do is to deliver training themselves as well. So apart from commissioning, they're trying to build their own training organizations. And it's all to do with funding because if they get funding upstream, then instead of distributing that funding to organizations to sort their training out, they want to provide training, they want to provide learning management systems. It's a challenge that we face as well as a private company where you're almost competing with the government, you're almost competing with government bodies as well sometimes. And some of these things, as you rightly say, Louis, weak assessment and feedback, this can be fixed. It's all about systems. And this is part of the tools that we give as well. Lack of the trainer courses, there is a real challenge out there. I've done some of those courses and I was left wondering if I didn't know what I knew already, would I actually be safe to go and train people about medicines, about safeguarding, about all these subjects that have a real impact actually on people's lives. And lack of consistency, that can be fixed as well. It's all about building that framework where, as an organization, you have your policies and you have your trainer register. Then you do your micro teaches to check that people actually don't not don't just have confidence to deliver, but they actually deliver meaningful sessions. There's a book called Telling Ain't Training, and a lot of trainers do tell how things are done, which is very good in other areas, but actually telling people is not the same as training them. Update information from trainers. So again, some trainers are left floating. I remember talking to an operations director of a big care company, and they don't get involved with their trainers at all. They just, there's 2, 3 trainers that are there. They go and deliver the training. They don't have a system in place. It's always worked, and they leave it like that. Keeping information accurate. So again, are you up to date with your CPD? Again, this is something that can be fixed with refresher courses. Changes not showing in training. Again, what sort of materials are you using? There are also some materials that should never be changed within your training systems. Management support is a big issue as well because a lot of people that are training also have other roles within the organization. Maybe they're working as senior carers or managers, doubling up, and they don't then spend enough time. So all these can actually be addressed. Again, it's to do with inconsistency, poor engagement as well. Sometimes when people get the same training over and over again with no variation at all. We talked about weak feedback systems. and unclear scope, which can be fixed by having that clarity within your policies as well. And then that comes with the refresher systems. So there are some common patterns which can be addressed. So thank you very much for to everyone there. So when we talk about subject matter expert, it doesn't equal a safe trainer. We've established that. So subject matter expert knows the topic. Many of us, as I said, will know what we're doing because we've been in the sector for a very long time. We've seen all the changes, and they're able to share experiences. And even if you're to give them a student, for example, to mentor a student, they'll do that. Even sometimes without even proper training as a mentor, they may actually be able to do that. They can explain the content very well, but again, explaining is not the same as teaching others or training others. They will be able to answer technical questions. They'll be able to do quite a lot of things. But a safe trainer will know how to assess needs to start with. They can assess the organizational needs. They can assess the staff training needs. And that's really an important starting point. Then they can then go on to plan and structure learning. Again, award in education and training gives a very good background to this, but also even in our train the trainer courses, we've changed them so that they actually mimic the system of the award in education and training, because it's not enough to just know the subject. You need to know how to structure training and deliver it safely. Adapting to different learners is also important because we are all grown ups, in the care sector. Yes, you have some teenagers working, starting out in the sector, but the majority of us are grown ups, but we learn differently from, say, 10-year-olds, 15-year-olds. So it's important to adapt your teaching to different types of learners, to check that people have understood and give them useful feedback as well, not criticism, not bringing them down. There are ways actually to do that. And working within the agreed scope as well, knowing what your boundaries are. For some of you that are nurses or doctors or allied health professionals, you know that if you have a code of conduct as a nurse or as a doctor, as a allied health worker, but even as a care worker, when you sign the contract to say you are taking the job, you are agreeing to working within the scope of what's been agreed. It's the same for trainers as well. So evidence is really important as well. So good trainers will know how to evidence everything that they are doing, including the feedback they give, the reports as well. If they run training sessions, what succeeded and what are the things that need follow up. There's certain people that you need to follow up and do one-to-ones. That's quite important as well. So the key point here is that knowing a subject is not the same as teaching it safely and consistently and within the governance framework. Your organization's policies and procedures provide that governance framework, and that should include what makes a safe trainer. Knowing the subject on its own is not enough. So let's look at the gaps, Louis, to look at the weakest competence domains to sort of say, do we have challenges in designing training? But even the needs analysis as well, I should have actually put needs analysis at the beginning, assessing the training needs. Do we have challenges in design? Do we have challenges in facilitation or checking, understanding, and giving feedback? Or actually designing inclusive materials, and the professionalism, which has been highlighted in the previous activity as well, that sometimes actually there's lack of professionalism. So yeah, Luis, if we ask people to do this as well, please.
Okay, yes. So again, I've just put in the chat what we're looking for. So we want to look at the trainer competence domain that's currently weakest in your service. Again, if this isn't something you've implemented in your service right now, you can base it on experiences of maybe other trainers that you've seen, whether they're external or internal, depending on what method you're currently using for training. But yeah, if you could answer um, one of those six. If you do have another different point, feel free to put it in, because we would be happy to discuss that as well. If what you're thinking isn't included in those main domains that we've put together. So we're starting to see some answers trickle through now. So thank you for that. Some interesting points. One has reiterated the needs analysis side. Should sort of come before the implementation. Inclusion seems to be the common theme. Three people have already said inclusion criteria. Design inclusion, the follow-up side of trainer competence. That's an interesting angle as well. Yeah, follow-ups are really important. You can attend events, one-off events, but if it was a bad day or things maybe were rushed, weren't covered properly, there was disruption in the session, or even if it's an e-learning course, for example, or a remote delivery like this, follow-up is really important. So I think that's a good point there. Design, updates, which is the theme from the last one, really about keeping, consistency with the content, the accuracy. Inclusion, again, is coming up quite a bit. Understanding, checking understanding. That's the first person who's mentioned that. So thank you for that.
Okay.
Yeah, I think they're most of the answers. So a lot, based on the people that have participated in the chat, seem to be touching on inclusion. There's also some interesting points outside of the sort of six domains that we'd put together for the session as well. Um, Couple of examples of that. The needs analysis that was touched on. Follow up, I thought that was an interesting one as well. The idea of following up after sessions, maybe checking knowledge.
Mm.
Um, Lack of professionalism. A couple of people have touched on that as well. Incompetency of stakeholders is probably not necessarily a trainer competence issue. It's more of a governance issue. Um, but thank you for that input.
Okay.
Yeah, I think that's all the answers we're going to get. So I think there's a clear sort of indication of inclusion being one of the biggest weaknesses with the group we've got this evening, but some other interesting domains that people have touched on that wasn't in the initial six that we'd identified. Yeah.
Okay. All right. So let's start with the training needs analysis. It's quite important, really. We actually have a module. So, Louis, maybe this is something that we can assign everyone who attended this session. We have a whole module on training needs analysis where you're actually looking at what the organizational needs are and then the different staff groups that you have in your organization. Then you are assessing what training needs they have for you to be able to meet the service user requirements. So what services are you commissioned to provide? What risks are there? So it's a very sort of neat way to do that assessment before you start doing your matrix. That actually informs what your training matrix looks like. So let's share that document, Louis. And I think there's even an interactive one that we designed that can be shared. When it comes to inclusion, it's really important. And again, we have materials for this. It goes into curriculum design and session design as well. Once you know what the needs are, then also look at the people that you have in your service. Are there people maybe where there are language barriers? Are there people maybe where they haven't had higher education? For example, they're very new to work, but without that the core elements. So again, the care certificate is quite good for this, but then the way care certificate is implemented varies as well, and that could have an impact. So induction training together with the care certificate is really important. Um, the different ways that people learn. It's not enough to just do slides. Some of the things you need to do demonstrations. Some people listen, some people read, some people like self-directed learning. So blended learning is quite important when it comes to curriculum design. So we talked about language barriers. Even the language that you use when you're delivering training, we deliver training to nurses and doctors. Some of the doctors we work with are highly specialized, but even the language that you use, you still need to use standardized English and avoid actually language that may, jargon that people may find, that people feel embarrassed to even come forward to ask. So never take anything for granted. Even asking questions, we're talking about checking understanding and giving feedback, really important. So we can give a framework, Louis, on how to make training more inclusive as part of the design. We talked about checking understanding and feedback, consistency of delivery and currency. Again, that depends on the organization. There shouldn't be much variation between trainers within your organization because you can control the materials that are used. People can have different styles of delivery. You shouldn't actually change, they shouldn't go on to change the core materials themselves. Maybe some people may like different examples, and that's okay, but things should be signed off. People should not be delivering training that hasn't been signed off. So, yeah, we will give some guidance on this particular slide, and even the course as well for needs analysis. So when you look at the competencies of a trainer, we talked about training needs analysis. It's missing here, Louis. In the future, actually, we need to add it to this slide. Training needs analysis is always the starting point. What training is needed and why? What sort of risks are we trying to mitigate with that training? Then we then go on to design and preparation. Learning outcomes are really important, and I'm very particular about this because we've got to know the difference between aims, objectives, and learning outcomes. Learning outcomes are, we're looking at what people are able to do after finishing the session. Aims are the goals, the wider goals that you're going to achieve in the future. And the objectives are the things that you are going to do in these sessions. So step by step that you're going to do to achieve the goals. But learning outcomes are really important because those are the high impact level of outcomes where people can change behaviors, for example, or maybe they learn new skills that they can apply straight away. So learning outcomes really, really crucial. And even our assessments have to be linked to the learning outcomes as well. Don't do trick questions. Don't ask them things that they haven't been taught. Make sure that everything is contained within the course. Facilitation is crucial as well. Pace is important. English is my second language, but I always try to speak clearly. I've always been taught to speak clearly. And I don't have to sound British or other. I can sound exactly the way I sound as long as I'm clear in how I'm speaking. That's really important. And to engage learners is quite important as well as part of the delivery and as part of the design of the curriculum. Then the third point is around checking understanding, questions. You can give people scenarios. We can even do role playing, when we do basic life support training or first aid training, you can do simulations as well, where you're simulating scenarios that people can do. Reflection is quite important for those that are professionally registered nurses, allied health professionals. It's actually part of the NMC revalidation, even HCPC, GMC. They want people to reflect on practice and then inform how they do going forward. Assessments are quite important as well, and feedback. It's not just about writing tests. It's about finding out where the gaps are. Then you assess people to fill those gaps. We talked about inclusive practice. So understanding the needs of the learners. There may be some people that have very specific needs within your organizations. It's about thinking how you're going to meet their needs as part of the design of the curriculum. Professionalism and reliability is important. Trainers actually have a duty to safeguard everyone who is sitting in that session, participating in that session. They should also be careful about boundaries between the trainer and the learner. This is really crucial. I know we fuss about it in schools and in further education colleges, but even in professional settings, it's really important to have that as well. Trainers should prepare well and be ready to deliver, and they should be able to adapt. You should always have a plan B, maybe even plan C. I've gone to sessions where all the tech doesn't work, but you still get to deliver the training. You have to always have plan B and plan C just in case things don't work. So good trainers don't just deliver slides, and it's not about beautiful slides, it's about really meaningful content that is designed to make a difference in practice. So we're going to talk about competencies in practice, so how we apply them in practice. So I did say about learning outcomes as a starting point. It's really important to start with learning outcomes and use examples from your own setting as well. There are a few companies that have provided train the trainer for years. And honestly, if you go onto Google and type in the question before you even finish, you'll see that thousands of people have typed in that question into the Google search bar to get the answer. And it's the same questions over and over again. It doesn't work like that. In care settings or in healthcare settings, you want to tailor training to your organization. Even if it's an external training provider coming in, you should always have some level of customization to your organization as well. Make sure that learners are involved. Don't just talk to them or lecture to them. Check understanding as the session is progressing, not wait until the end. It's like if you're delivering a first aid course. Yeah, you can't just fail someone at 4 p.m. when they've been sitting in the session throughout the day. You should have picked up along the way that there are issues that this person that needs to be addressed with the person. So one of the things that we're going to give you at the end is to give you a template for this activity where we are asking you what one practical improvement you can make, whether in design or needs analysis or facilitation, understanding. So we give you all the background information so that you can actually go and assess your own organization to say, look, where are you weakest and where are you going to make the most impact If you need to come back and talk to us, by all means do. We're open, and we can talk to you. Even if you're not a client of ours, we're happy to engage actually with people that come to these events. So I talked about micro teach at the beginning. So a micro teach is a short observed teach that we use actually to test whether somebody has planned and can deliver safely and effectively. If you have done the award in education and training, it's actually part of the training. Right at the end, you're going to plan a session, and then you are going to design it, and then you're going to deliver it to a group, and then they give you feedback. So you set your own scope based on your audience and the topic of choice. But obviously, if it's within your organization, you can give them a range to say, maybe look at diabetes, maybe look at safeguarding, or whatever you want people to deliver on. Then they can deliver face to face and make it a habit as well. Even when you hire external trainers, one senior person should always sit, even if it's just briefly, they sit there for 30 minutes, an hour. Then they get feedback from the learners as well to say how did they find it. It's part of your own system in that sense. But if you're delivering a micro teach, others are observing. There'll be other learners. Maybe there'll be experienced people in the room as well. They're not marking you right or wrong. The idea is they want to see the strength of your delivery, the strength of your planning. Then they give you feedback, highlight areas of strength, highlight gaps where you need to improve, and the exact action points you need to take. Because obviously, if you're investing in someone to become a trainer in your organization, you don't want to set them to fail. And once you've done that, you can then sign them off to say you're happy for them to deliver training, and you set the scope of what training they can deliver, at what level they can deliver. So level 1 is basic awareness. Level 2 is for people that are going to make decisions in practice. And then level 3 is a higher level. So micro teach is not just signing things off and ticking boxes. It's actually about evidence. When you're then asked to provide evidence of your training system, you can show that you did the micro teach assessments for all your trainers. So the authorization outcomes for micro teaching, we have done this before where we train an organization, maybe they send 4 or 5 people. I think the biggest group we had 8 people for moving and handling. What they just wanted was to put the largest number of people in the group. A lot of them actually were not suited. At least half of them hated just being there for those 2 days because they're nurses, they're busy in a care home. Some of them are doing night shifts. They don't like the fact that they've just worked a night shift. They haven't rested enough. It becomes really difficult for you to sign off, actually, to say you're happy for these people to be signed off as trainers. But otherwise, if you're happy with everything and their micro teach, their delivery, their practical skills, then you sign them off to say they're authorized and ready to deliver within the agreed scope of your organization. Sometimes you may be happy with certain elements, but not all the elements. It means then you have to decide as to whether they co-deliver with an experienced trainer so that they can be signed off, or maybe you restrict the scope to say maybe they deliver the theory but not the practicals, or you restrict the scope to say they deliver only level 1 but not level 2 or level 3. Maybe they need additional observation. Maybe they need to go and do an additional course, especially for practical subjects like people moving and handling, basic life support, even medicines management. Some people that are training medicines management shouldn't be anywhere near that course at all. And sometimes you actually decide that, look, I'm not going to authorize this person. And we've done that when we've done train the trainer for businesses to say, look, I'm happy with these 2 people. The other 4, they're not ready at all. They need to get a bit more experience. They need to do more courses. Then maybe 6 months down the line, we can come and assess them again. And sometimes organizations are not happy because if they paid money, they want everyone to pass. But it's not just a matter of passing someone. If you think about it, nurses go to university for 3 years to do a degree. They do pharmacology, anatomy and physiology. They go and do placements. And they have to work under supervision for at least 3 months before they can start giving medicines. But then we want sometimes care workers who have very little experience, no formal education, higher education, and we expect them to go and train others in medicines management. It's dangerous. We can't do that. And even as an organization, you should also think about that. So there's a case example here. Louis, I don't know if I give this to you, where we have a case where there's a trainer who has good subject knowledge. They're quite credible and confident, but their delivery is a bit rushed. They lack engagement, and they're not very good at checking, understanding, checking that people they're training have understood. So we want to hear from you as to what decision you would make for this trainer. Are you going to authorize them straight away to continue training? Or are you going to authorize them with conditions? And what sort of conditions are you going to put there? Or you're not going to authorize them at all? There's no right or wrong answer. We just want to hear your thoughts.
Excellent. Yeah, so we've got this as another poll because I think it'll be good to get the spread of opinions from the group. So I'm just going to launch poll number 2 now, and it should be on screen for you all. So please do put your thoughts and opinions. Again, not necessarily a wrong or right answer. Just interested to see where people's mindsets are with this particular scenario, which, as I'm sure you can imagine, is pretty common sort of scenario that you would see in different services up and down the country. Okay, we've got some answers coming through now, so thank you very much. Um, just okay, majority of the group have actually gone authorized with conditions, but quite a few of you have also got not authorized yet. We do have one who's gone for authorized. Um, just give this poll, only 63% have participated so far, so we'll give the full 90 seconds for everyone to join in. Please do engage. Okay, final 10 seconds.
Okay.
Okay, 190 seconds. So, um, I wouldn't say an overwhelming victory sort of for number 2, which is authorized with conditions, but that is the most popular answer. We've got a
Mm,
couple of people who've gone with authorized, and the remainder, which is about 41% of the attendees this evening, have gone for not authorized yet.
mm.
So I'll just share those results on screen, and maybe we can just do a bit of a debrief there on the poll results.
All right. Thanks, Lois, and thanks everyone for participating. So this is a governance decision. It goes back to your policies as well now to say what what do your policies say regarding your trainers? And I found many organizations actually that didn't even have a policy around their trainers, whether internal or external. It's important to have that. So personally, I would authorize someone like this with conditions. Yeah, because we're saying that they have subject knowledge and they're quite credible, but they're a bit rushed in delivery. So maybe they need a bit of training around delivery styles and public speaking even. Then also engagement, maybe it's to do with curriculum design, to say, if we designed our curriculum in such a way that it stops them from lecturing, for example, and engage with their participants, and also how to check for understanding and give feedback. People can get trained to do that. So the part of it is maybe they deliver alongside somebody else who's more experienced in addition to the training that they've done. Feedback to them as well is very important. You're not criticizing them, you're giving them feedback to say, look, we've done the micro teach, we've set in your sessions, and this is what we have found. And some people may not like that. And I've had situations where somebody just couldn't believe that we had said that she needed to improve in certain areas. This lady had taught in the NHS for many years, right? But for the subjects that we wanted her to deliver, we felt that she needed a bit more support, and she just gave up. She couldn't believe actually that we would say that many years later she did come back to me and said, you know what, I probably rushed that decision. She actually went on to do those improvements and carried on training in another organization. You can restrict the scope, as we said. Maybe there are certain elements of the course that you feel that somebody who is a bit rushed, whose engagement is weak, should not be delivering. Additional observation with support is quite important as well. Or maybe they just need to go and do additional training. So it's a matter of you thinking what works from the governance framework that we have as an organization. The point is not to pass everyone, and some organizations do force things. And then now you find 2 years later, none of those people are doing any training at all because you ignored those telltale signs of those weaknesses. So let's think as well about other elements. For example, coaching. It's understated a lot in training and development. I have coaches for different things. I had a speech coach. I had somebody who was coaching me around public speaking. I had somebody who was coaching me about different things, even in business as well. So if you look at right now, there's the World Cup happening in America, in Canada, Mexico, and the USA. Every football team has a coach. And they've several coaches. They've goalkeeping coaches, the penalty coaches, and all those. So why are we not taking advantage of coaching? And there are a lot of people now. If you go on LinkedIn, you find a lot of credible people, and it doesn't even cost that much actually to do some of those coaching sessions. So as an organization, if you're going to be investing in people, invest in them wholeheartedly, not just sending them to a train the trainer course and expecting them to come back and be able to do everything all at once. So one other element that we need to think about is the refresher courses. And I think within a poll in March, the vast majority of organizations, more than 60%, were not doing any refresher courses. People had done train the trainer many years ago, or they'd done the award in education and training, and they've not done any refreshers at all. Refreshers are important because you avoid drifting, right? Guidance and practice change. Right now, as we're speaking, a lot of legislation is changing. Even as government is right now is restricting what teenagers can do online. Right, so that means our safeguarding courses and child protection courses are going to change. The guidance that we give to organizations, primary schools and colleges is going to change as well. Right, materials become outdated if you're not researching, if you're not doing your CPD. Your materials are going to get updated very quickly. Poor habits as well, trainer habits become normalized. Delivery quality also reduces over time. And when you get new learners or new subjects or new problems, then you start to have all sorts of problems. So good refresher systems will keep you updated. You'll get up to date with the changes and also what's happening in the sector. You get observation of delivery as well and feedback from other people who are not in your organization. So you can be in a safe space where you can be given feedback, professional feedback. Reflective practice is important as well. We do that more and more where we want people to reflect. This is the generic information, but what does it mean for your own organization? CPD, we highlighted how important that is, and scope review as well and reauthorization where needed. Because, for me, for example, I still teach resuscitation courses, but I can't go and teach ILS and ALS. I've been out of practice for many years, right? But I can still teach basic life support. I can still do basic life support training the trainer and a lot of the first aid courses, in that sense. So if quality and auditability matters, which is governance, refresher training is not an option. You have to have a system for refreshing your trainers. So let's do a poll, Lois, around the refresher systems that people have or formal reviews. This is something that people are doing as part of their governance framework.
Yep. So I will just launch the third final poll. Um, Again, four choices: yes, routinely, sometimes no, and not sure. Um, Please, particularly for those of you that already have internal trainers, be great to get some insight from you on this, and then we can look at the results. I'll just give 60 seconds for this one. It's quite a quick one. Quite a lot of the group have already participated, so thank you very much for that. Okay, we'll just give this another 10 seconds. About 70% of you that have joined in so far. Again, I appreciate some of you may not have these systems already in place. Can maybe talk about personal experiences or people that you know in this arena, what their understanding of train the trainer and the idea of refreshing these courses that people do enroll onto. Okay, brilliant. So let me just end the poll there. So we do have a clear winner with yes routinely. 48% of you have said yes routinely, which is great. Really healthy to hear. 22% have got sometimes. Again, that's probably something from a systems and governance perspective that needs to be looked at, but it could also be an understanding issue as well. Different organizations have different sort of refresher validities on certificates, and maybe not a system for rebooking and so on, or changing suppliers or providers, which makes sense. We've got 17% of people that have said no. There's no refresher system in place at all, and 13% who are just not sure, which again is a pretty interesting answer. So I'll just share those results on screen, and we can just have a quick summary on the poll results there.
Yeah, thanks, Louis. Again, there's the Care Quality Commission are checking these things now. When the people are trained, when their CPD up to date, and they're looking at the risk within the organization, and are you doing enough to mitigate that risk? So again, we're going to give you guidance, over the next few days that you can download and you can use within your organization to assess. There are no hard and fast rules as to how often you refresh. But what we have done is we've used the core skills training framework and even the skills for care framework as a guide. So generally for training the trainer, if you refresh every 3 years and make sure that you do some CPD in between as well, that should suffice. So we're nearing the end now. Quality assurance, as I said earlier, it's not just about filling in paperwork. There are three different types of quality assurance that you can have, whereby the one that I recommend the most is preventive quality assurance, where prevention is better than cure. So you make sure you have policies and procedures in place, you have a governance framework, you've approved training materials, you've done your micro teaches, people are signed off, if they need to do a refresher, they're up to date, they've clear scope as to what they can train and what they can't, and also the way they prepare. You give them time to do that as well. You give them time to go for CPD and attend sessions to keep learning. Then the active QA, which is in addition to the preventive observation, and making sure that you also look at the feedback from the learners. How many people are passing? If there are people that are having challenges, what are the actions that are being taken? Consistency is quite important as well. So checking as well. Where there are issues, action plans, be involved actually with the action plans, send people for coaching and supervision, make sure that they do refresher courses, and where necessary, restrict their scope. So again, we'll give you a minimum evidence dashboard that you can use. And we do have actually a system that you can use for training management system. You can trial that system to see whether it works for you. And Louis is the person to talk to for that. So with that in mind, I think we can give them this to take away. We don't have time to do this poll, but we'll give them the materials to have a look, to do their own assessment. And they do need anything in addition, then we can support people as well. So I want to go to the key takeaways that we want to take away from today. Trainer confidence is not enough on its own. We need to have people that are confident, knowledgeable, and can adapt their training. But also subject matter expertise does not qualify people to train in any subject. Same as AET. For AET, doesn't qualify you to train in any subject. It's a baseline qualification that helps you then go in and start training others. Micro teach is important, but it's quite understated. Always do it as an organization. Even when people already have certificates, ask them to deliver a short session and then see whether they're suitable or not. Refresher training is absolutely crucial. It's part of the quality assurance that you need to be active actually with the quality assurance and preventive as well. You need to show the evidence as well, the evidence trail, not just certificates to say we've done the training. You've got to show the evidence that you've done everything else. Safe training systems are built on competence, authorization, refresher training, quality assurance, and evidence. That's it. We've finished the set session, and Louis will give you some additional materials, but also some additional thoughts. We can hear from you from the question and answer, and also the next steps of the certification.
Okay, thank you. Yeah, we are in the final segment of the session this evening. So there have been a couple of interesting things come up in the chat. I have seen them. We will touch on them as at the start of the Q&A because I think they're both interesting questions or interesting points of view. We don't necessarily want to get into a debate over some of the comments, but we can just give you a professional sort of opinion on those sort of things. as takeaways. And again, if you need any further support in some of those areas, we'd be happy to help. But what I'll do just while we're answering a couple of the points that have come up in the chat is I'm just going to put the Google form link now in the chat. You should see that there. It's a hyperlink. Whether you're using a phone, tablet, laptop, or a desktop device, you should be able to follow that link, fill in the information. Our team will then sense check that against your participation and how long you've been in the session this evening, and you'll get a CPD certificate tomorrow via email before 5 p.m. UK time. I know we've got a couple of international attendees this evening as well. So please don't forget to fill that in because it is your gateway to getting a certificate. We do have to be quite strict on that based on some recent events that we've run. So do not forget that. And if you've got any issues, you can contact our support team tomorrow. We can sense check your participation and attendance as well. But it would make things a lot easier if you could just fill that in. So a couple of things that come up, Richard, before I open the Q&A. We've got one question here regarding the refresher process. So one member of the team actually asked, would a monthly one-to-one and an annual review work? Because they're a training team with a workforce management manager. Um, I think there's sort of 2 points at play there because a train the trainer refresher is slightly different to sort of a one-to-one performance review. But maybe that's an interesting sort of scenario that we could cover, particularly for a bigger organization, which this attendee is potentially involved with. Yeah.
Yeah, look, there's a difference between supervision and then the trainer competencies as far as the subject knowledge is concerned. So it depends on the subjects that you are training people in. If you're involved in general workforce development, for example, rolling out induction training programs, it may be different. I remember when I worked in the NHS, we would have what they call the corporate induction, which was generic. And usually those people didn't even need to be trainers themselves. Even the CEO would come and say a few words, the health and safety person would say a few words, but then you then go and do specific training. If you're clinical, you then have, and those people that are delivering that sort of training, they need both the monthly supervision, annual sign-offs, but depending on the subjects that they're doing, you also need to do a refresher for those specific subjects. Resuscitation is a classic one. If you're a resuscitation cancer yoga trainer, you have to do your refreshers. You can't get away from that. And that's the same standard that we should take for other subjects as well.
Excellent, thank you. So we do have a Q&A, a specific Q&A section for further questions. We've also got another one here from a member. I am keeping these anonymous deliberately, by the way, for people that may be wondering why I'm not using their names. But we've got another attendee here stating, what if the organization won't fund refreshers? What do we do then?
It's a real challenge. It's a risk to not do refresher training, especially the way CQC are going now, right? And even the commissioners, they are demanding because they know that it's a cottage industry where there are a lot of cowboys, where that training is not even worth the certificate. It's, they say you've done it, right? So if the organization is not going to fund refreshers, they're taking a risk, and you're also taking a risk. And I think it's a conversation that needs to be had, and even as you do your one-to-ones as well, to raise these concerns as part of your one-to-one. It's a matter of time before CQC actually just starts ripping things apart to say, look, if you're not doing refreshers, just like your statutory and mandatory training, then you're not compliant. We're nearly getting there from some of the experiences we've read. We've gone into rescue organizations that had trainers and certificates on the wall, but none of those people actually should have been training anyone. Certificate does not guarantee you your competences. Yeah.
Excellent, thank you. I'll just wait for some of the questions to come through the Q&A. We are into the final few minutes. There was, I thought, an interesting debate in the chat actually about a previous point where we touched on the microteach scenario. A couple of our attendees were a little bit confused why any authorization would have taken place based on the scenario presented. I know we did cover the conditions then after that, but maybe we could just reiterate that point for some of the attendees who feel any authorization would have been incorrect.
You could authorize with conditions. That's the one that I went for. Number two, I wouldn't authorize them fully. And the reason being, conditions then, it's like nurses even. If a nurse is restricted practice, they're still registered nurse, but they can't work independently. They work under supervision, then they can sign off for competencies. So you don't want to penalize people for failing to meet the standards at the first attempt. So if they have other qualities that you value in a trainer, you then put conditions on how they can work. A lot of it is around restricting the scope of their what they can train others in, right? So again, it depends on the organization, it depends on the individuals. We're a training company. We've had trainers where there were two trainers, Louis, you remember these, where we never fully signed them off. And in the end, we just had to let them go. They were just never going to improve. Even no matter how many times we went through things, no matter how many times they went with other people, one of them spent more than a year just being the second trainer. Unless we needed a second trainer to support the delivery in some way, it was pointless sending him alone to do any training. And in the end, we had to let them go. Yeah.
Yeah, thank you very much for that. We've got one final question here that we'll cover today, um, which is around people's background for training, which I think is a really interesting question. So, do trainers have to have specifically a medical background to conduct public health training programs, for example, or be a trainer? I think that's the point that the attendee is getting at. So, does
Okay.
the occupational experience is it a really important factor?
Occupational experience is crucial, really crucial. There are certain subjects where, for example, first aid at work. There was a time where most of the trainers were ex-military, right? And for some reason, the health and safety executive just used to have those groups of people. But actually, anyone can go and learn to be a first aid trainer. But if you don't have the occupational experience, how are you going to be able to remember all those things? How are you going to remember between bandages and stopping bleeding and medical emergencies and all those things? There are some subjects that you just can't have people that don't have the occupational experience delivering. Manual handling in when you're moving objects in a warehouse is quite different to moving and assisting people. They're quite different subjects. The principles are the same, but actually moving and assisting people is quite different. The equipment is different. You have to think about the care plans. You have to think about the medical conditions. So I think sometimes we underestimate the importance of occupational experience. It's crucial. But there are subjects perhaps that things like safeguarding, things like you still need some occupational experience, but equality and diversity. I've seen people teach certain subjects that are perhaps safer to deliver, but there's some subjects that I just wouldn't compromise on. And even you as a trainer, you'd have to think very carefully. Occupational experience is important.
Yeah, definitely, definitely. Okay, there's no further questions. I have just put in the chat the link to the form. Please do fill it in. As we said at the beginning of this session, we will have an email going out over the next couple of days with a link and some more information on the downloadable takeaways. We will also be running another event in the next quarter on this topic. So based on some of the feedback that we get, we'll be planning that session and we'll put a date out in the next few weeks for our Q3 webinar. So again, hopefully everyone's found some insight here, learned something. It's great that the chat has been very busy tonight as well. Different people with different opinions, whether challenging people or really being honest with where their organization is at. It really helps us as a provider. But hopefully other people within this meeting have learnt from some of the exchanges and topics we've discussed today. And we'll also be giving you something useful to go and take away and at least test or try and implement in your business. So yeah, thank you very much for your time. If you do, or if you can, or you have a smartphone next to you, if you wouldn't mind leaving us a review as per the QR codes on screen, that would be much appreciated. We'll also send an email out with any feedback that you have. We're always trying to improve these sessions, and for those of you that have participated in any of our webinars, you'll see that each of them there is a slight tweak that we've made to all of them to try and make them more useful rather than just being the same delivery every time. So feedback, positive or negative, is always well received. So yeah,
Constructive, not negative, please. Constructive.
constructive. Yeah. Okay, excellent.
Thank you. Thank you.
Thank you, everyone. We will hopefully see you again in the next quarter. And yeah, thank you for your time this evening.
Thank
Bye bye.
you. All the best. Thank you.